Hi, I'm Dr. Andrea Hsu here at Animal Medical Hospital of Pasadena. Today we're here with this little one, and Maya, and we're going to have a conversation about spaying and neutering our pets. What were some of your questions for me today?
Well, my first question is, what is a good age to get neutered? I've heard before 1 year and I've heard after 1 year. I'm just not sure.
Yes, good question. So spay and neuter, spay is for females, and neuter is for males for castration. Typically it depends on the size of the pet and sometimes the breed. So for larger breed pets, we do advise to wait until they're after a year of age for neutering. For spaying, we do recommend to, no matter what breed they are, to spay before their first heat cycle. Most of our pets will go through their first heat cycle or their period between maybe like 8 to 10 months of age.
And do you spay during heats?
Recommend not to spay during heat. The reason is their vessels can be really dilated and it has a higher chance for complications. Oh, here you go.
Gotcha. And then when we do neuter this boy, I did hear about another procedure that we can do at the same time, the gastro.
Gastropexy. Oh, good question. So gastropexy means gastro, stomach. Pexy means attachment. So gastropexy is actually attaching the stomach to the body wall. We do that for large breed deep-chested dogs to reduce the chance of bloat and gastric rotation. So bloat is a syndrome that large breed dogs, if they eat too quickly, they then run, or vice versa, they go running or they're panting a lot, and then they eat a full meal, then they can bloat. Once they're bloated, they have a higher risk for gastric torsion. By doing the gastropexy, it is advised for, again, large breed, deep-chested, very high active pets. By doing the gastropexy, it reduces that chance of gastric rotation. They can still bloat, so be careful. Don't overfeed your pet still. Here you go. Ready? Good job. Good job. Okay. So during his pre-op examination, we found that he has 2 descended testicles. That being said, then it will be a routine neuter. Some pets, if they don't drop their testicles, then they're called what we call cryptorchid. So we have to make a separate incision. Oops, there you go. Depending on each pet, they'll come in for their pre-op examination. And during that exam, we'll palpate their belly, palpate and localize their testicles. It's important that we know the location of their testicles because it will determine the point that we will have to neuter them. Either we'll make an incision dependent on the testicle location in their abdomen, on their inguinal area, or right above their scrotum. So for this guy, he'll have a routine neuter.
Okay, perfect. And then what procedures can we take just to make sure that that neuter or a spay goes well under sedation or anything like that?
So before they come in, like we're doing right now, we're having our pre-op examination. During today's visit, we're gonna get a little bit of blood work on him to make sure that his insides match his outsides. And if his blood work looks good, then we can go forward with his neuter.
Oh, perfect.
On the day of the procedure, he'll be fasted, meaning no food or water after 10 o'clock the night before. We do this because we don't want him to regurgitate or vomit during the procedure. We want to protect him. Here you go. Then plan for him to stay with us for the course of the day, and then we'll discharge him later on that evening. Okay. For aftercare, he's pretty rambunctious, so it's really important that he stay quiet. Depending on the surgery and your veterinarian, we'll make recommendations as for the length of time. This little guy, he may need to be crated post-surgery because we don't want him running around and opening up any sutures.
So much.
All right, let's go ahead and get some blood work on you. Why don't we head over to treatment? Come on, let's go. See ya. Bye.